My name's Jennifer Stratton. I've had essential tremor. I was diagnosed at 6 years old. My hands will tremble. I think that it goes into more of my body if I'm really nervous. I quiver all over. It's just not something I can control. One thing that I have to do is hold the glass with 2 hands. Especially if I've heard a loud noise in the morning or there's extra stimulus, I can't carry a third of a cup of coffee across the room. It's not a reflection of my emotions whatsoever. Where I struggle most with the tremor is probably in my social perception.
In the case of Jen Stratton, she's a very busy office professional. She's the CFO of a large company. Her tremor is debilitating, and it interferes with your ability to type on a computer, attend meetings, travel, eat. All these functions are affected in her lifestyle. My name is Nizam Razak. I'm a neurosurgeon. From my perspective as a physician, this is why we treat patients. This is why we work in healthcare. Essential tremor is a life-altering problem for most of these patients. It's something that they're eager to get treated as soon as they can.
Women know that it's a struggle, our perception that we can be logical and business-like and make good, strong business decisions, and it's even more difficult to cast that perception while I'm trembling on the side of the room in the meeting. It's almost as if I was silently crying, and even no matter what I do, if I explain, I just have a tremor. It looks like I am having severe anxiety. I'm so excited to get the procedure and watch this thing turn off and go about my life, not casting a perception that is completely false about myself everywhere I go.
Today is the day of the surgery. Ms. Stratton came in today very excited. She's ready to go. All right, Jen, we're gonna go ahead and get started. My name is Zarak Cadet. My role here at UCF Lake Nona Medical Center is the coordinator of the Focused Ultrasound program. We do give her an assessment before surgery, and it allows us to see just how her tremors are affecting her. The surgery is focused on her brain, but we still have to shave her head.
Morning.
Good morning.
You all ready for today?
I'm ready for today.
This is the first time the focused ultrasound has been used in Central Florida and applied to patient care. If you can imagine a bunch of sound wave beams coming into the brain, and they all meet at one point. That's what focused ultrasound is. There's no cutting of any sort. The entire procedure is carried out in the MRI scanner. It takes about an hour and a half to 2 hours to do. Essentially, the patient walks in with a debilitating tremor and walks out with no tremor.
I'm so happy you guys. Are you so happy and relieved? Like, oh my God, you can't imagine the difference.
This is the type of work I set out to do. Because when you see the effect you have on a human being that has a debilitating disease and the smile on their face, sometimes they cry coming out of the MRI scanner because they know right away their life has changed for the better.